Today, we're talking about something that most patients never see directly, but that affects millions of medical decisions every single day. It's called prior authorization. If you've ever wondered why doctors sometimes can't immediately order a test, prescribe a medication, or send a patient to rehab after surgery, there's a good chance prior authorization is part of that reason. But here's the statistic that should stop everyone in their tracks. More than 80% of prior authorization appeals are successful, which raises an obvious question. If insurers overturn the majority of denials which physicians appeal, why are so few appeals actually filed? More importantly, what does that mean for patients? We're going to unpack the numbers, the real-world consequences, and why this administrative process has become one of the most controversial issues in modern healthcare.
Welcome to In Good Company, Elder Care in Your Backyard.
Let's start with the numbers. A 2024 analysis from the Kaiser Family Foundation looked at Medicare Advantage prior authorization data submitted to CMS between 2019 and 2022, and the results were striking. In 2022 alone, only 1 in 10 denied prior authorization requests were appealed. But among the appeals that were filed, 83.2% were either partially or fully overturned. Think about that for a second. That means that the vast majority of cases where physicians challenge a denial, the insurer ultimately agrees the care should have been approved. This suggests something uncomfortable. Many of the initial denials may not have been appropriate in the first place. So again, the obvious question remains, why aren't more physicians appealing? The answer is complicated, and it reveals a system under enormous strain. The first major reason is time. The American Medical Association surveyed 1,000 practicing physicians and found that doctors and their staff spend an average of 12 hours every single week dealing with prior authorization requests. 12 hours. That is essentially a full business day every week devoted to paperwork instead of patient care. In many practices, the burden is so large that staff are hired solely to handle prior authorizations. In fact, 35% of physicians report having employees dedicated exclusively to this task. But many practices, especially smaller clinics, simply cannot afford that. Physicians often face a difficult choice. Do they spend hours navigating appeal processes? Or do they move on to caring for the next patient who needs help? This administrative burden helps explain why only 18% of physicians say they always appeal prior authorization denials. There is also a second factor at play: experience. Many doctors have learned through the years of dealing with insurance companies that appeals can feel like a losing battle. According to the AMA survey, 62% of physicians said they don't appeal because they believe it won't succeed. 48% say patient care cannot wait for the appeals process. And 48% say they simply lack the staff or resources to pursue those appeals. One physician, Dr. Daniel Edney, an internist in Mississippi, described a scenario that highlights the real-world consequences. Some of these patients drive 2 hours just to reach his clinic. If a prior authorization denial forces them to wait days for approval, those patients must go home and return later. For working-class families, that is often not realistic. When patients cannot return, they may abandon care altogether. That is where prior authorization stops being an administrative issue and becomes a patient safety issue. The AMA's physician survey found that 94% of physicians say prior authorization delays necessary care. But it does not stop there. No, doctors reported real clinical consequences from those delays. According to the data, 19% of physicians say prior authorization delays led to a patient hospitalization. 13% reported a life-threatening event, and 7% reported permanent harm, disability, or even death. In updated data from 2024 through 2025, the problem appears to be getting worse. More than 90% of physicians now say prior authorization delays access to care. And 24% report that it has led to a serious adverse event for the patient. These are not abstract numbers. They represent real patients whose treatments were delayed, interrupted, or never received. Many of these concerns around prior authorization today focus specifically on Medicare Advantage plans. Medicare Advantage is the private insurance alternative to traditional Medicare, and enrollment has grown rapidly in recent years. With that growth has come increasing scrutiny. A 2025 survey of skilled nursing facilities found that 66% of nursing homes report Medicare Advantage plans deny or delay medical necessary post-acute care on a daily or even weekly basis. Nearly 1 in 3 facilities say it happens every single day. Even more troubling, 67% of nursing homes report that Medicare Advantage plans have withdrawn coverage for patients against medical advice. In other words, insurers sometimes terminate coverage for care even when physicians believe it should continue. Once again, appeals often reverse those decisions. Among nursing home providers surveyed, 54% say denials are sometimes reversed on appeal. But the appeals themselves are costly and time-consuming. During that time, patients may be discharged earlier than medically recommended, which can compromise their recovery. The effects of these delays ripple across the healthcare system. For example, research shows that Medicare Advantage patients stay in hospitals about 9.6% longer than those on traditional Medicare. Why? Hospitals are often waiting for insurers to approve post-acute care placement in rehabilitation or skilled nursing facilities. Longer hospital stays may sound harmless, but they can carry real risks. Higher rates of hospital-acquired infections, increased physical deconditioning, and greater stress for patients and their families. In some cases, delays can even lead to treatment abandonment. In fact, 78% of physicians say prior authorization hassles cause patients to abandon recommended treatments. Another emerging concern involves the use of artificial intelligence in coverage decisions. In 2025, a federal judge allowed a class action lawsuit against Humana to proceed after allegations that AI tools were used to deny post-acute care coverage. The lawsuit claims automated systems may be replacing human clinical judgment in determining whether care is approved or not. Critics argue that when algorithms make coverage decisions without adequate oversight, the risk of inappropriate denials increases. Regulators are beginning to take notice. Congress and the White House have pushed insurers to reduce unnecessary prior authorizations. Federal regulators have also signaled that future rules should introduce guardrails around AI in coverage decisions. Many healthcare leaders say much more still needs to be done. Organizations like the American Medical Association are advocating for several reforms to improve this system. Some proposed solutions include reducing the number of services that require prior authorization, improving transparency about what information insurers require, and implementing programs known as gold carding. Gold carding allows physicians with a track record of appropriate prescribing or ordering to bypass prior authorization requirements. Another proposed reform would require insurers to honor prior authorization approvals for the entire duration of treatment, especially for chronic conditions. When patients switch health plans, some advocates want new insurers to honor previous approvals for up to 90 days. The goal is simple: reduce unnecessary administrative barriers while still allowing insurers to monitor costs and prevent fraud. The debate around prior authorization raises a fundamental question about how healthcare decisions should be made. Should insurers act as gatekeepers controlling access to care? Or should physicians and patients have greater authority in determining what treatment is necessary. Right now, the system sits somewhere in between, and many believe it is not working well for anyone. Doctors are overwhelmed by paperwork, patients are confused by insurance rules, and insurers face growing scrutiny from policymakers and regulators. Let's return to that statistic we started with. More than 80% of prior authorization appeals succeed. When doctors push back against denials, they usually win. But because appeals require time, staff, and persistence, most denials are never challenged. In the meantime, patients may face delays, complications, or even abandon treatment altogether. Prior authorization was originally designed as a tool to control costs and assure appropriate care. The growing evidence suggests that in many cases it may be doing something very different. It may be standing in the way of care that patients actually need. As policymakers, insurers, and healthcare providers debate reforms, one thing is becoming increasingly clear. The stakes in this debate are not just administrative, they are clinical. And for many patients, that is deeply personal. For In Good Company, I'm Spencer Ernst, and we'll see you next time. If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.